friends, I am Dr. Monica Agarwal. I am a gynecologist based in Chandigarh, and today I want to create awareness about premature babies as this is the prematurity month going on. So, in one line, I would like to say the premature babies are babies who are born before 37 weeks. Out of these, the extremely premature are the ones who are born before 28 weeks. The very premature ones are who are born between 28 to 32 weeks, and between 32 and 37 weeks are the various ranges of mild to moderate prematurity. As we can all see that these babies are born before time and hence they face few problems. The immediate problems are basically they are not able to breathe properly, they are not able to feed, they face a lot of infections, and also they can undergo sudden infant death syndrome. The long term issues which these babies can face are cerebral palsy, mental retardation, vision problems, hearing problems, and various other growth and developmental issues. So these babies immediately may need care in the neonatal ICU for a few weeks or months. Hence, they put the families in a lot of emotional, financial, and physical burden. So, as we all know that prevention is better than cure, so there are some certain preventive measures which you can take even before planning a pregnancy so that you don't land up in such situation. First of all, the pregnancy should be planned. The spacing between pregnancies should be proper. You should avoid any kind of smoking, tobacco, alcohol, or substance abuse during pregnancy. You should follow all the instructions, diet guidelines, and medication as instructed by the doctor. You should be going for regular health checkups to your doctor. And during these checkups, we try to do high risk identification of the patients who are at risk for undergoing premature deliveries, and we offer them progesterone pessaries or cervical circulage or the cervical stitch if they fit into the guideline. The IVF patients should try to avoid higher order pregnancies. They should go for a single baby. Now, there are certain high risk factors in the mothers which may have increased risk of premature birth, like pregnancy happening in extremes of ages like teenage pregnancy or advanced age pregnancy. If the pregnancy happens too soon, if the mother is having some kind of alcohol, drug abuse, substance abuse, she is not able to get proper medical care. She is into some kind of stress, depression, she had some kind of infection, or if the pregnancy is of higher order like twins or triplets. Sometimes we are not able to pinpoint any reason for such situation, and this is the very frustrating situation for the parents. Now, if the baby is born prematurely and lands up in the neonatal ICU, the first question of the parents is when can we take the baby home? So there are certain criteria which the baby needs to fulfill. When the baby has gained around 2 kgs of weight, the baby is able to keep warm without the incubator on itself. The baby is able to breathe properly without assistance. The baby feeds properly, gains weight properly. These are the criteria when you can take the baby home. And obviously these babies need more regular checkups to the hospital than the term babies. Now, when you take these babies home, you are anxious about the care of the baby at home. So there are certain things which you can follow at home. You have to help these babies sleep by feeding them properly, keeping them warm, dimming the light of the room, and preventing the sudden infant death syndrome, which these babies are very prone to undergo. So you should avoid these babies sleeping on their stomach or their sides. You should also avoid overheating these babies. Avoid putting any pillow or blanket in their cots. You should be very careful while sleeping together. Practice breastfeeding for as long as possible. Practice kangaroo mother care. Also limit the visitors and avoid the public places. Please identify all the warning signs and symptoms in these babies and be ready to prepare to go to the hospital if the baby shows any danger symptom. Now, if we talk about the emotions of the family, you can experience both positive and negative emotions in such a situation. Positive emotions like joy, love, and the negative emotions could be of guilt, sadness, depression, anxiousness, lot of anger. So first of all, try to accept your emotions. You should be kind to yourself. Connect with other parents who are in the same situation. Connect to friends and family who can help you. Get help, and look after yourself also. You should kind of have some me time, connect, bond with your baby, and celebrate all the milestones of the baby. I hope my talk today helps you understand prematurity and helps you uh, understand this situation better. Thanks a lot for your patient hearing. Thank you.